everyone. Namaste. Today, I'm just going to go over kind of a deep dive of some details of ozone therapy and a little bit of the history. This one, I'm just going to explain some of its applications, how it works, what conditions might benefit from ozone therapy, whether it be home ozone therapy or with a doctor. So please stick with me, and I hope you enjoy the video. Ozone therapy is not new. It has been used medically since the 1800s. While ozone use in medicine is and has been much more common in Europe, particularly Germany, Austria, and Russia, it has also been used in the United States. However, in 1933, the American Medical Association began a movement to block or eliminate any medical treatments that could compete with pharmaceutical drug treatments, which is possibly why you may have not ever heard of it. Ozone, or O3, is a triple oxygen molecule, meaning there are 3 oxygen atoms instead of 2, as in normal oxygen. Ozone is anti-pathogenic and kills virus, bacteria, and fungus. It is completely non-toxic and has no side effects. Ozone's history is quite long, dating back to the 1800s, and for the sake of brevity in this video, I'm just going to give some of the highlights. Ozone was discovered in 1840 by the German-Swiss scientist Christian Schonbein when he was experimenting with electrolysis in water, and he noticed a distinctive odor, similar to that during a thunderstorm. He then succeeded in isolating the new chemical and named it ozine, after the Greek to smell. And in the period following that, there was much research conducted using ozone as a disinfectant. In 1857, the first ozone generator was created by Werner von Siemens in Germany. And in 1896, the first ozone generator was patented in the US by none other than Nikola Tesla. In subsequent years, Tesla began making and selling ozonated oil. During the First World War, ozone was used medically on soldiers, primarily via limb bagging to treat gangrene and trench foot. And by the 1920s, medical ozone use was widespread in both Europe and in the United States. In 1926, Dr. Otto Warburg of the Kaiser Institute of Berlin announced the cause of cancer to be due to lack of oxygen at the cellular level, and was awarded the Nobel Prize for Medicine in 1931. However, in 1933, the American Medical Association set out to block and eliminate any medical treatment that would compete with pharmaceutical drugs. The suppression of O3 therapy began and continues to this day. In the 1940s, the FDA began seizing O3 generators from doctors. Regardless, French physicians Dr. Aubourg and Lacoste introduced rectal and vaginal ozone insufflations and also began injecting ozone gas into wounds. There were no harmful effects reported even after 8,000 applications. In 1940, German physician Hans Wolff wrote Medical Ozone, which is still used today. In 1952, the National Cancer Institute verified Dr. Otto Warburg's findings on lack of oxygen being the cause of cancer. In 1971, Wolff and Reiling found the German Medical Society of Ozone Therapy. In the 1980s was the first international conference on the medical use of ozone. In the 1990s, Cuban doctors report success with treating eye disorders with ozone. And by the 1990s, ozone therapy began regaining popularity in the US and continues to this day. It is actually a very long and colorful history, and this is only a very brief synopsis. So if you're interested in the deep dive on the history of ozone therapy, there are plenty of resources online. O2 and O3 therapies work by addressing and correcting hypoxia or low oxygen. So the fact that there is a chronic condition points to hypoxia. Hypoxia, in this sense, is referring not so much as to how much oxygen you are breathing in, but how well your body makes use of the oxygen that it does take in. Dr. Frank Schallenberger, who's one of the foremost physicians in the United States today practicing ozone therapy, devised a method to determine how well the body is utilizing oxygen with a measure known as VO2 or Volume Oxygen Testing. He uses an FDA-approved gas analyzer to conduct the test. With this test, he can determine how well your body utilizes the oxygen it takes in. Dr. Schallenberger uses this information to form a measurement that he calls a patient's, quote, EQ, close quote, or energy quotient. A high EQ represents efficient oxygen utilization. The higher your EQ, the less likely you are to get a disease. Dr. Schallenberger considers EQ to be the most significant marker of a person's health status. And he even goes so far as to say, if you have a high EQ, then no disease ever. Conversely, cancer, fungus, mold, and bacteria, viruses, grow in hypoxic or low oxygen environments. Ozone therapy, whether done at home or with a physician, may just be a very valuable tool in the toolkit of the individual who values their sovereignty, particularly their health sovereignty. Ozone therapy, along with many other natural therapies such as chiropractic, acupuncture, herbalism, etc., which are cost-effective, very accessible, and have no side effects, are still being debunked as pseudoscience and quackery, which of course is not true, but the pharmaceutical industry is well aware of the threat to their monopoly on healthcare. Should the Pandora's box of alternative healthcare methods be opened to the public? Dr. Schallenberger noticed a connection between a patient's oxygen utilization, or EQ, and their mitochondrial function. Mitochondria are an organelle within each cell, which manufacture the ATP, or the fuel that runs all our cellular functions. The phenomenon we call aging can be translated as mitochondrial decline. If or when mitochondrial DNA is damaged, when the cells reproduce, the corrupted DNA is also duplicated. Over time, as more damaged cells accumulate and are reproduced, then the appearance of aging results. O3 therapy can come to the rescue as it stimulates the body's antioxidant enzyme systems, of which there are hundreds. The increase of antioxidant enzymes works to protect and preserve the mitochondria, thus slowing or halting mitochondrial DNA degradation. Dr. Schallenberger found that in patients with a high EQ or efficient O2 utilization had a higher density of mitochondria in their cells, up to 50% mitochondria in their cells, and thus aged more slowly. This would explain the interest in ozone therapy by the regeneration or anti-aging community. You may be interested in checking out his book, Bursting with Energy, which is linked below. Ozone therapy, whether you're doing it at home or in a clinical setting, has a variety of benefits, a long list. First being, it triggers self-healing responses in the body. It reduces systemic inflammation. It optimizes cellular circulation, O2 uptake, and distribution. It increases metabolism. Woohoo! It catalyzes hundreds of self-healing sequences. The primary benefits include detoxification, immune support, anti-inflammatory. It improves brain function. It improves neurological function. can benefit respiratory diseases. It can enhance athletic performance, weight loss, of course, via the increase in metabolism. It's touted among those that use it as, quote, youthing, due to its anti-aging effects with the mitochondria. It's toxic to pathogens. Another important benefit is O3 therapies, O3 being ozone, can be combined with whatever else you are doing for your health, whether it's natural or if you're taking medications. It can even be combined with chemotherapy. Ozone therapy can become a part of your health maintenance routine. It's important, if you're doing home ozone therapy, that you have a pure oxygen source. That means that you cannot make ozone with your ozone generator from the ambient air. So you will need a pure oxygen source, which would be a medical or a industrial oxygen tank. Ozone therapies influence all autonomic nervous system functioning, which include sleeping, eating, breathing, digestion, elimination, and sex drive. So what conditions can ozone therapy address? A better question is actually, what can it not address? But people have experienced benefits with issues like cardiovascular disease, stroke, autism, Parkinson's, brain injuries, arthritis, neurodegenerative disease, chronic diseases, chronic pain and stress, anxiety and depression, PTSD, etc. It can offer symptomatic relief of brain fog, chronic fatigue, confusion, memory problems, insomnia, mood swings, irritability, and headaches. Also, balance and speech problems have gotten results. The treatments that you can do at home include ozonated water, ozone insufflations, bubbled ozone through olive oil. So the ozone gas cannot be inhaled directly, or else it will trigger a coughing fit. However, it can be inhaled after it's bubbled through olive oil, which it will then be transformed into ozonides and terpenes, which are very beneficial. Other treatments that can be done at home include limb bagging, suppositories, and steam sauna. Treatments that can be done with the assistance of a doctor include hyperbaric IV ozone or 10-pass ozone therapy, Prolozone, where ozone is injected into the joints, spine, or other regions of the body to reduce inflammation. There are also many uses of ozone in a dental context, which both can be done at home or at the dentist. I myself, having received an ozone injection in the site of a tooth extraction, which eliminated my need to take antibiotics. So thank you so much for watching. I hope that you found that informational. I hope it was helpful. I hope it cleared up any questions that you might have about what ozone therapy is and how it can be used. So if you enjoy this content, please like or subscribe. You can definitely leave a comment below if you have one. And I really appreciate you watching. Thank you so much. Be well.